workers, and you have 65 plus. 3 separate groups. We want to be fair in the allocation. Well, then do it by percentage of population. We are. Healthcare workers are about 21% of the eligible population. So we distribute 21% of that region's allocation to healthcare workers. Essential workers are about 27%. So we allocate 27% of that region's allocation to essential workers. 65 plus are more than half, 52%. So we distribute 52% of that region's allocation to the providers who serve 65 plus. No one is happy. Everybody wants more. What do? You just be as fair as you can possibly be with the allocation you have. And that's what we're doing. The 3 different groups are provided for by 3 different providers. Essential workers are done by city and county departments of health. Why? Because that's the normal liaison with the police and the fire and volunteer fire. They have the most accessible relation to the city and county governments. We're also asking the large unions, large forces to self-administer. So the city and the county don't even have to do the administration. They just hand it to the police department and let the police department's medical officers do it. Hand it to the fire department and let the fire department's EMTs administer it. Again, the vaccination is not rocket science, so with due respect to Dr. Zucker. It's a vaccine. And EMS workers, EMT workers administer a vaccine in the normal course of business. So essential workers and the percent that essential workers represent, 21%, goes to city, county departments of health. Healthcare workers go to the hospitals. Nurses and doctors work in the hospitals. Doctors' offices are affiliated with hospitals or FQHCs. But that's the normal accessibility for them. Healthcare workers get 27%. So 27% goes to hospitals, and then 65 plus, we don't want them walking into hospitals. There are a lot of people who are ill in hospitals. We don't want them walking into City Hall. So retail establishments, pharmacies, mass sites are where we're doing the 65 plus. It's important that the provider follows the prioritization, because otherwise they're giving that group's allocation to someone else. And I've said this repeatedly, but I understand the stress level and the anxiety level. At least we have to be able to say we are fair. If you give the police dosage to 65 plus, then the police don't get it. If you give the 65 dosage to hospital workers, then the 65-year-olds don't get it. So please follow the Department of Health prioritization. Otherwise, you're robbing Peter to pay Paul. That's all you're doing. The Trump administration, and I said this not because he's out of office, I said it while they were in office, this was all unnecessary chaos and confusion and anxiety. Everybody agreed nursing homes were the top priority. Everybody agreed with that. All Americans agreed with that. You have vaccines, they're limited, give it to the people in the nursing homes. Everyone agreed with 1A. Nurses, doctors, give it to them. They're on the front lines. They're dealing with COVID-positive people every day. I'm not. They are. And if they get it, they're super spreaders. And if they get it, the hospitals close down. Everybody agreed. First responders, essential workers, Everybody agreed. They could all be potential super spreaders. They're more exposed. They then opened it up to 75 plus, which made sense. But again, you are already way over capacity. By the way, we still have not received enough supply just to do 1A and 1B. If they had only opened it up to nursing homes, healthcare, and police officers, we still have not received enough supply even to get past nursing homes in 1A. We wouldn't even be in 1B yet if they opened the categories sequentially. Then you open 75 plus, then they open 65 plus, all at the same time. So you now have 7 million people, all who are eligible, and they're chasing 250,000 vaccines per week. It made no sense. And it created chaos. What should have been done, nursing homes first. You finish nursing homes, go to 1A. You finish 1A, go to 1B. Then, after 1B, and again, we still wouldn't be through 1B. We wouldn't be through 1A. We've done 1.3 million dosages. How many people were in 1A? Who remembers? 2.1? 1A is 2 million people. We've only done 1 million dosages. We would still be in 1A. But then go to 1B, and then if you open the age groups, you should have opened it as a priority by age. I'm 90 years old. I should go before the person who's 65. I'm 90, I should go before the person who's 70. And it should have been opened as you had allocation. Anyway, that is not what we did. It's not what they did. And now you have a period of confusion and anxiety because you're trying to hit 7 million people at 250,000 a week. That would take 7 months. President Biden has said he'll produce 100 million dosages in 100 days. That is about 1 million per day. New York State is about 6% of the population. That means we would get about 60,000 doses per day. That's about 420,000 dosages per day. That is higher than we are now. Even at 420,000 dosages per day, per week, I'm sorry, you still have to do 7.1 million. That still takes you 17 weeks. So, all this to say, this is going to be a long several months in distribution of this vaccine and the anxiety that has been created. I'm hopeful that the Biden administration can figure out how to increase production and shorten that 17 months. And I think the president is right. I'm not accustomed to saying that. Increase production through the Defense Production Act. And let's do it. We should have done it a year ago. But increase production because that is the bottleneck right now. With all of this said, hospital capacity is still our top priority, and hospital capacity is going to come down to how many hospital staff get sick. That is what is going to happen. Much of what has happened since the first onset has not been a surprise. I feel like I'm standing on the beach and you see in the distance a large wave building. And we're standing on the beach, and the wave is building, and the wave is getting closer. Don't be there when the wave hits, right? The UK strain is here. The UK strain is spreading. We still are only at 67% vaccination rate of our hospital workers. This is a problem. We're supposed to be at 70 to 90% for herd immunity. And the hospital workers are the people who, if they get sick, the hospital capacity will collapse. The hospital capacity collapses, we have to close the economy. We're working very hard on this message, and we're working very hard to get the hospitals to get their staff vaccinated. I've spoken to dozens and dozens of hospitals. There is a broad disparity. Some are at 100%. Some are at 50%. Average is 67. It's ticking up. It was 65 on Wednesday. It was 62 last week. But we have to do more, and we have to do faster. This is the percentage of hospital workers across the region. And you see the variance. Central New York is 82%. You then go down to 61% on Long Island, 62% on Western New York. What accounts for that? 82, Central New York, 78, North Country, 69. We need the hospital staff vaccinated. That's why they were 1A. More good news, we completed the first round of vaccinations of nursing homes because they were the most vulnerable population. 70% vaccinated so far. The vaccination rate among nursing home residents is higher than the vaccination rate among nurses and doctors. Social equity is also a pressing issue. We have a COVID-19 equity task force. We want to make sure that everyone has access to the vaccine. There are two issues there. One is accessibility, and we're working on that. The second is the willingness to accept the vaccine, and we're doing everything we can on accessibility. We're going directly to public housing projects, but we have a problem with skepticism about the vaccine, especially in black and brown communities. And I'm working with clergy, I'm working with community leaders, I'm working with respected doctors, nurses. I understand the skepticism about the federal government and the past federal government and their vaccination approval. It gave the sense that it was political. I get the historic skepticism, especially among the black community with the Tuskegee experiment, etc. That's why we had New York doctors approve the vaccine in addition to the federal government approval. And people said at that time, oh, why would New York State do this? It's redundant. If the FDA says it's safe, and if HHS, federal HHS, says it's safe, then it's safe. No, because people did not believe that administration. And they did not believe that HHS and that FDA. And by the way, as I say to members of the black and brown community every day, I don't believe them either. I had my own level of skepticism and cynicism about the previous administration. But I'm not taking their word for it. We had New York doctors go through it. We have the best hospital network on the globe in New York. They have all gone through the vaccine. It is safe and it can save your life. But I need the clergy members, I need the medical community. We have to get past this skepticism problem, and we have to do it quickly. Otherwise, without this vaccine, the UK strain hits, you're going to see the death rate go up. As an aside, in the budget, we're doing something called 21-day amendments where you can amend the budget and add certain things. I just want to make sure people are aware. We have consumer utility protections in the budget. Right now there's a statutory cap on what the utilities can pay for damages. So there's a storm on Long Island. People get hurt. Public Service Commission determines that the utilities were not ready or whatever. they charge a penalty to the utility. In the law, they have caps on the amount a utility can be penalized. NYSEG was penalized the other day. It was only $1.5 million. Why only $1.5 million? The damage was much worse. Well, because the law capped the penalty. The laws, and these are old laws, but they were basically a utility protection program. Why would you cap a penalty? The penalty is commensurate with the damage. That's what a penalty is. But at one time the utilities were very powerful, and they were powerful with the legislature, and the law protects them. That has to change. You can't artificially limit the penalty. The penalty is what the penalty is. The penalty is equivalent to the damage. If you create $10 million worth of damage, the penalty should be $10 million. Also, they can't shut off utilities because a person can't pay in the middle of an emergency like COVID. That's in the bill also. Also, internet providers, which now have limited regulation from the state and can often be very abusive to consumers. If you have a problem with an internet provider, it is the most frustrating process that a consumer can go through, and really there's nobody to complain to. Many of them have basically a virtual monopoly, and they're not responsive to consumer complaints. We also want to say internet service providers, low-income families, you cannot charge more than $15 for the basic internet service program. We go to remote learning and kids are not in school. If the household doesn't have internet, that child doesn't get an education. And I'll tell you who that child is. That's a poor child, a black child, a brown child, a child in public housing. And education is supposed to be for everyone. So that's in the budget also. Also, and this was announced last June, okay, about 7 months ago, public safety is a crisis in this state and in this nation. The lack of trust between police and the community is worse than anything I have seen in my lifetime. The feelings are very high. Police feel victimized, they feel terrorized, they feel that the community disrespects them, they feel that they are the scapegoat, they feel that they can't do their job, and if they can't do their job, they're not going to try. Members of the community feel that they've been victimized and they've been terrorized. Our great Attorney General just did a report on the New York City Police Department that finds basically that the police have been using unfair tactics against protesters for a very long time, tactics that were supposedly no longer in place. This relationship has to be fixed, and it's not going to fix itself. The communities, we have 500 communities with police departments. Put the people at the table like this: police, community activists, representatives, and talk through the issues. Everyone in the state needs public safety. The police serve everyone. When you see these spikes in shootings now, you know who's dying? Black and brown and poor people. Those are the victims of the increase in crime and the increase in shootings. Forge a collaborative, talk through the issues. It has to work for the police. It has to work for the local community. And I can't do it from Albany because there are 500 different police departments. And by the way, what works in Rochester is different than what's going to work in the North Country, is different than what's going to work in New York City. They have to do it. I said this in June. I said, form the collaborative and let people talk. By the way, the collaborative itself can be cathartic. I'm offended and I want to be able to express my feelings and my fears and my thoughts, and I want you to hear me. That's the collaborative. You never solve a problem in life that you refuse to acknowledge or you deny. I believe that's true in our individual lives. It's also true in our social lives. You deny a problem, it doesn't go away, it gets worse. And that's what we're doing. I said in June, if you don't have a new reform plan passed by your community by April 1, you won't get funding in the state budget. I've said this 11 times. The plan is whatever your community wants. Nobody's saying, we're telling you what's in the plan. Oh, state government is telling us how to police. No, we're not telling you how to police. We're saying, I'm saying, figure out how you're going to police. What is your plan? And get it passed by your local legislative body. But get it by April 1. So I told you in June. That was June, July, August, September, October, November, December, January, February, March, April. Some communities are doing a great job. I mean a really great job. And they've been creative, and I talked about them in the State of the State. And they're using it for the opportunity it is. Every system has to reform. Every system has to reform periodically. Education has to reform. Everything we do has to reform. The environment has to reform. Criminal justice system has to reform. And the police department has to reform. How you policed 20 years ago is not how you police today. We're smarter. We're more savvy. We have more technology. There are 70 days left to April 1. Don't think the problem is going to go away. Your community has to be safe. And 70 days for those communities who haven't made progress is a blink of an eye. So this is just a reminder. As I announced on the State of the State, New York is operating on multiple levels right now. Track 1, defeat COVID. Vaccination, stop the spread, manage the hospitals, win the COVID war, stop the strains, win the COVID war. Job 1. At the same time, we are anticipating the post-war reconstruction. And we're actually energized by it. There's going to be a transformation moment. And places are going to rebuild all around the world. And we think we can be the first and the best in the rebuilding. And that's why build, baby, build. I love that expression. And you know who's going to be the first to build? The first one with shovel-ready projects who can actually deliver. When President Biden passes an infrastructure bill, which he will, he's been dedicated to it all his life. He's going to look for projects that are ready to go. I know that. He said it. I've been in the federal government. Nobody wants to fund a project that's going to take 3 years to break ground. That doesn't stimulate the economy. New York is going to be ready to go. That's why we're queuing up all these projects, ready to go, ready to go. As soon as that federal bill is passed, we are ready to go. And we're going to be starting on our own, not even waiting for Washington, because I've been waiting a long time. So, simultaneously, all of this is happening. Win the war, post-war reconstruction. Do both at once. It's hard. It's not hard. We're New York tough. We're smart. We're united. We're disciplined. And we're loving. Questions, operator?
Thank you, Governor. If you'd like to ask a question, please use the raise hand function at the bottom of your window. We'll take a moment to compile the Q&A roster. Governor, your first question comes from Peter Haskell at CBS 880. Peter, please unmute your microphone.
Hey, Governor, you've been critical of CDC guidance saying 65 plus, but it's just guidance. Some states, including Connecticut, are holding the line at 75 plus. Why did you decide to go to 65 plus, and did that add to the chaos?
I think there would have been more chaos, Peter, if we didn't allow the 65 plus in when the federal government said they were eligible. You know, a lot of people think what the federal government says has wisdom behind it. And when the federal government said 65 plus, the entire community of 65 plus said, great, I'm now eligible. It's a tough balance. All of this is a tough balance. But I did not want to frighten the 65-year-olds by saying, even though you are eligible by the federal government, we're not going to make you eligible here in New York. I think that would have increased the panic and the anxiety and the tension. So I said very clearly, we're going to open it up to 65, but, and I said this, Peter, explicitly, we're going to open it up to 65, but I want you to understand what that means. It means there are now 7 million people that are eligible for 250,000 vaccines a week. At that time it was 300,000 vaccines a week. I said, Peter, I'm passing Matilda's rule. Matilda's rule, it's named for my mother. She's 65 plus. That was close. She's 65 plus. Yes, you're eligible, but it's going to take weeks to get there. So good news is you're eligible. Nobody's saying you're not eligible. Bad news is, Matilda's rule, it's going to take weeks. I think at that time at 300,000 it was like 14 weeks or whatever we contemplated. But I said that at the same time. So yes, 65, we're not arbitrarily discriminating against you. It's not that we don't like 65-year-old people. But we're going to follow the federal guidance, not to create anxiety, but you need to understand what that means, and that's Matilda's rule. And I said that from day one. My mother's still unhappy with me, but I told them the facts, nice and clear on day one. Next question.
Your next question comes from Miles Miller from WNBC TV. Miles, please unmute your microphone.
Hello, Miles.
Miles, please unmute your microphone.
Miles does not want to unmute his microphone.
All right, we're going to move on. Your next question comes from Gwen Hogan from WNYC. Gwen, your line is open. Please unmute your microphone.
Hey there, Governor. Can you hear me? Thanks for taking my question.
Yes, Gwen. Just hold on one second, Gwen, because I had another thought for Peter Haskell, my friend. Also, remember, Peter, when they said they were opening it up to 65 plus, they also said they were going to increase supply and production, right? That's when they said they were going to free up their reserves because they had more reserves and they were going to increase production. That never happened either, which made it worse. I'm sorry, go ahead.
Hi there. Yeah, this question is for Gareth Rhodes. I'm wondering what you can tell us today about the demographic breakdown of vaccine distribution, at least for the state-run sites, which I know is data that the state has. Earlier this week, the governor said he couldn't give information from the counties. 17 states already provide this information. And secondly, I just wanted to ask about the state of COVID outbreaks in the state's prisons. There are outbreaks in about a half of them. No timeline for when inmates will start to receive vaccines, at least the most vulnerable of them. New York City has already started to vaccinate the most vulnerable inmates, so I'm wondering when the state will start that process.
Sure. So on the first question, we have over 1,200 providers who are receiving the vaccine. right now and distributing it. There's a lot of data coming into the system. We are compiling it. We are analyzing it and making sure it's accurate. Once there's accurate data that we feel comfortable with, we can release it. But the key here is you can only put out data that you feel comfortable with. There's a lot of providers still getting used to the input into this system. So we'll continue to do that, and once it's ready, it will be released.
And then on the, I can take that one. So obviously, this is something that we've been talking about standing up and operationalizing. Just so everyone's aware, in the 75 plus category, there's about 250 prisoners who are 75 plus across the entire system. When it goes down to 65 plus, it's roughly 1,100. And so that's the population, and we're trying to figure out the best way to start to deploy resources, obviously in the context of fairness, given that the demand is so great universally across the public, how we can manage both of those demands at the same time. But it's a not relatively, it is a teeny tiny population.
Next question, operator.
Next up, we have Stacy Sherman from Bloomberg News. Stacy, please unmute your microphone.
Hi, Governor.
Hiya, Stacy.
Good. You said that you're confident that the Biden administration will be able to increase supply. How do you recommend they do that? What would you advise him? What do you think is the quickest way for him to get you more supply? And then one more question is that UK is reporting that its variant of the virus may be linked to higher death rates. Based on what you know and what you've seen, is that surprising to you?
Short answer on the second part is yes. I've heard the exact opposite. I'll ask Dr. Zucker to comment because that would be frightening news because we know it's more transmittable. We were told repeatedly it's not more lethal. What was the first part of the question again? Do you remember the first part of the question? Well, why don't you talk about the
confidence in the ability to stand up additional vaccines from the federal government.
We know, well, the Biden administration has said, when they say 100 million in 100 days, that is 1 million per day. That's roughly 400,000 to the state of New York. That is more than we are now receiving because we're only receiving 250,000. So just the 100 million over 100 days, that's more than we're now getting. Point one. Point two, increasing the Pfizer production, increasing the Moderna production, accelerating the Johnson approval, using the Defense Production Act, those are all ways where you can increase production beyond that. And if any administration is capable of doing that, I believe it's the Biden administration, especially compared to the Trump administration, which, getting back to Peter Haskell's point, remember, they said they were going to increase supply. They said they had a physical reserve and they were going to send the second doses immediately. That was all untrue. So we then planned, and the public heard, 65 plus, and there are more doses. And that never happened. So the worst case scenario, and that's what I'm trying to do here, at least be honest and be straightforward and tell people the truth. And don't create false expectations. Anybody can get it 65 plus, and we're going to increase supply because we're going to send the second dosages now. That was just not true. It was just not true. Dr. Zucker, did you hear anything about this UK variant?
So this is information which I heard a little bit about this just this morning, but the UK science advisor said that the issue of lethality is not yet strong, and so I have been in touch with them over the course of last week, and we'll speak with them again. You have to also look at this from two perspectives. That's one issue, lethality, but also the fact that it's more transmissible means that there are going to be more cases. If there are more cases, there's more hospitalizations. If there are more hospitalizations, obviously there's a risk of more deaths. So, so I haven't heard the details of what you're specifically reporting or hearing, but I do know that the UK science advisor said that it's not the lethality is not yet, evidence for that is not that strong.
Have any of our UK cases passed away?
No, we have 25 cases and none.
Nobody's passed away. Well, that's good news. Okay, next question, operator. Let's take two more.
All right. Your next question comes from Dan Clark at PBS. Dan, your line is open. Please unmute your microphone.
Hey, Governor, how we doing?
How we doing, Dan?
Very good, thank you. I'm wondering, in the spring, you were very critical of President Trump for not issuing a national mask mandate, and President Biden has only been in office for a few days. You're a close ally of him. Are you disappointed that he hasn't issued a national mask mandate like how you wanted the former president to do?
Well, look, New York was the first state to pass a mask mandate in the United States of America, and I'm proud of it. I think New Yorkers in many ways were more informed about COVID. We had a different experience about COVID, and I think New Yorkers got it, and I was willing to propose it and push it, and New Yorkers did it. New Yorkers did it. Mask compliance is like 98% in public spaces. And that's because of New Yorkers. Now, is the country in a different place? Look, you have some states that still are in various stages of denial. I think what President Biden did was a step in the right direction and is going to make a significant difference. My position, as I did in New York, is I would mandate masks all across the board. But what President Biden did is actually much, much better than what had been done before. We had a president who was saying, basically, don't wear a mask, even though his advisors were saying wear a mask. And it was total anarchy. So President Biden himself wears a mask. His staff wears a mask. He has a mask mandate. Obviously, our mandate is broader, and I support our mandate, but I understand his. Operator?
Your next question comes from Bernadette Hogan at the New York Post. Bernadette, your line is now open. Please unmute your microphone.
Hi, Governor. How are you?
Bernadette?
Okay, so two questions. One, you were just talking about President Biden and the mask mandate, but wanted to get your thoughts on the other day, he was at the Lincoln Memorial and he was not wearing a mask, and this was hours after signing the executive order mandating the use of masks on federal property. And so wondering what you think of that. His top spokeswoman defended this and said, he has bigger things to worry about. So should the president be setting a good example and be wearing masks regardless of bigger things to deal with? And then number two, with the vaccines, right now, is the state allowed to use second dose allocations for first doses, or how does that work? And how does the Defense Production Act change our vaccination program, and what do you hope that it smooths out going forward?
What does what? It burned out. So what was the last four words? You got broken up.
Yeah, with the Defense Production Act and the Biden administration's promise to utilize that, what bumps in the road, what problems with the vaccine program do you hope that will iron out?
Okay. Let me answer both. First, I don't know what you're talking about with the Lincoln Memorial. I just missed it. But I think President Biden has, all through his campaign, all his public appearances, he's been a phenomenal example of wearing a mask. Every public appearance I've seen him, he comes up to the microphone, he has a mask, and then he takes the mask off. In public, he has a mask. I don't know about the Lincoln Memorial, but this is a dramatic contrast to President Trump, who was the exact opposite. Yes, I think President Biden should wear a mask within the rules, right? I'm not wearing a mask now. You don't always wear a mask if you can socially distance, et cetera, partitions, et cetera. But I think everybody should set a good example all across the board. On the Defense Production Act, there are no bumps. The Defense Production Act would allow the United States to increase production of PPE. It would allow increased production of N95 masks, of gowns, of face shields, all that madness that we went through, where I was calling China on a daily basis, trying to buy masks, where the owner of the New England Patriots, I had to ask him if he had room on his plane that was going to China to bring back masks for us. Governor of New York, trying to get masks so nurses can protect themselves. I have to ask a private person if they have room on their private plane to pick up masks in China. I mean, how more of a bizarre situation. And by the way, they were very gracious, and he was beautiful, and he did it. So the Defense Production Act can help on that. It's more complicated how the Defense Production Act can help on the production of the vaccine itself, but there are also ancillary products that it can help on, right? We ran out of nasal swabs in testing. We ran out of Q-tips. A nasal swab is just a big Q-tip. And this nation couldn't figure out how to make Q-tips. The Defense Production Act gives the president the authority to say to a manufacturer, we're going to pay you, but I need you to increase your capacity to make nasal swabs. I know the Post didn't support it, but it's a philosophy question. I think a lot of damage was done, a lot of pain was caused. And I think when this nation is at war, and COVID is at war, the president should act accordingly. When we're in World War I, World War II, you have factories transformed into factories to build tanks and bullets and rifles because we're at war. COVID is at war. And our front line, the nurses and doctors, didn't have masks and didn't have gowns. And the governor of New York is asking a football team owner if he has space on a plane. I mean, that's not government. Next question, operator.
Governor, your last question comes from Jesse McKinley at the New York Times. Jesse, your line is now open. Please unmute your microphone.
Hi, Governor. Two questions. Can you walk us through what sort of surveillance testing the state is doing for the UK variant? Like how many samples it's running to kind of get a sense of how widespread that is in hard numbers? And the second question would be whether or not the state has taken any supply from hospitals or clinics and taken them to state-run sites.
Yeah, answer to the second question is no. Answer to the first question, I don't know. Do you know the testing on the UK variant?
We're doing about 1,000 genome tests a week. We've done over 6,000 or so. We look for all the variants. We map the entire genome, so it's not just the UK variant. We look for the variant from South Africa, from Brazil, and anywhere else to see if we've identified that in New York. So far, we've only identified the UK variant.
Okay, just point of clarification. I have said multiple times, if there are faster providers, we'll give them an additional allocation if they can get the vaccine out quickly. I don't know that have we done that yet?
Where there are providers who are not able to use up their full supply, we have been in a position where we can move it to another hospital or someone who serves that same category of eligible population, but that is working together with that hospital or pharmacy to make that transfer happen.
So maybe a hospital or a pharmacist. All right, guys, gals, guys agenda neutral. New York Tough, go Bills. Go Bills, Kansas City, big game. Bet Bills. Have a good weekend.
All right, welcome back to Yahoo Finance Live. Miles Oven here in New York. As we continue to see the vaccine rollout here in the U.S., one company is hoping their drone technology will be a part of accelerating the pace of distribution. Cameron Chell is the CEO of Dragonfly, and he joins us now to discuss. So, Cameron, let's talk a bit about where you hope to fit in to the vaccine rollout and what kind of timeline we're looking at.
Sounds great. Well, thanks for having me. Dragonfly is the oldest commercial drone operating company in the world. We're lucky enough to be a public company. DFLYF is our symbol. And we have multiple organizations, whether they're health agencies, whether they're vaccine distributors, approaching us now looking at ways to get vaccines, whether it's the current COVID or whether it's ongoing vaccines, into challenged locations. These might be remote locations. They might be locations that are hit by natural disasters. They might be locations that are offshore rigs. But really looking at the efficiency to be able to get this critical cargo onto places or at places or to people in a more efficient way.
So Cameron, you guys are the designers of these drones. You don't make the finished product. So you've got this contract to develop this drone. What's the timeline for actually getting it out there, deploying it, doing the vaccine delivery?
Yeah, so what's different about Dragonfly is the fact that we provide a total solution. So whether it's the design of the drone or whether it's the